Hey everybody, so I have been working on this course that I'm going to be offering that is a step aside from the actual regenerative injections, that's more so focusing on what I'm kind of loosely calling integrative orthopedics, which is this idea that there are certain things we can do outside of regenerative injections that can be beneficial to help people optimize from the actual injections they're getting, maybe never need injections, and basically just to help with their musculoskeletal orthopedic concerns using these different various approaches. This is something that I've been thinking a lot about ever since I first started working with patients in chronic pain many years ago, and it's developed into, right now at least, what I'm calling the CNAMES approach, which is an acronym, clearly, because who would call something CNAMES, but an acronym that is the five main areas, CNAMES, man, this has been it's Monday, but it's all right, six different areas in the body that we can look at to determine, do we need to intervene here? How much do we need to intervene, and how are we going to intervene? So the CNAMES approach then is going to be the connective tissue. So that's going to be things like the tendons, the ligaments, the cartilage, things like those are the typical things that are going to be approached when we are doing the actual regenerative injections. So we have cartilage, we're going to have the nervous system. This applies to the peripheral nerves that might have some neurogenic inflammation, they're releasing substance P, things like that. But it also could be central nervous system. How is your overall parasympathetic versus sympathetic nervous system functioning? Because that's going to change how you are perceiving pain, how you are moving through life, things like that. Then we're going to have the articulations. So that's the actual joint proper. Is there any misalignment? Do we have cartilage degeneration? Is there a fixation or subluxation in particular joints that are going to be contributing to why patients are in pain, things like that? So we got connective tissue, we got nervous, we got articulation, we have the metabolic system. This is going to be things like obesity. This is going to be things like hyperglycemia or hyperinsulinemia, so high blood sugar or high insulin levels. Things like inflammation, whether it's systemic or local. How can we look at that area, and how can we kind of differentiate between those things and approach? Then it's going to be the endocrine system, and this is a big, huge system. So this is where we're going to look at thyroid hormones, adrenal hormones, sex hormones, the adipokines, leptin, adiponectin. We're going to look at growth hormone, IGF-1, a whole host of different systems within the endocrine system that we can look to optimize in order to optimize our regenerative injection procedures. And then the last is going to be the stem cell niche, and that's going to be both local and it's going to be systemic. And so the local stem cell niche is in any given area is usually the fat pads that are around that area. So for the knee, for example, we're going to have the suprapatellar fat pad, we're going to have the infrapatellar fat pad. Those are two fat pads where there's a rich source of mesenchymal stem cells and perivascular cells and preadipocytes, these things that have been shown to have regenerative capabilities because they're progenitor cells or stem cells, and they are going to help to repair the tissues that are surrounding it. So that's the local. And then on the systemic side of things, we're going to have the microvascular bed, basically the entire capillary tree, capillary, however you want to say it, US, Canada. But that's where the perivascular cells are going to live. So perivascular cells are these cells that line all of the blood vessels, and we're talking about the capillaries here. They line all the capillaries, And when there is damage to the capillaries, those perivascular cells become activated, they come off, they become a mesenchymal stem cell, and then from there, they're able to help modulate the immune system and the inflammatory response, which is going to help in the orchestration of healing. And again, that's whether it's an acute injury, like you rolled your ankle, or we actually go in with an injection like PRP to stimulate a new healing response. And so in the time that I've been working in the regenerative injection space, one of the big things that has really been brought to my attention through patients is that the better the health of the patient before the procedure, the better they are going to respond from the procedure. And so that's what's really led me down this road of, well, how can I improve the health of the patient before a procedure, after a procedure, so that way we can maximize what we're getting out of the actual regenerative injection. Because my ultimate goal at the end of the day is to spend time with patients to not just address the current concern that they're in, such as their knee pain, their neck pain, their low back pain, those types of things, but also make them healthier as a whole human. So that way when they leave my office, meaning like the time that we spend together, whether that's 2 months, 6 months, or 3 years, they are better off than when they came in, not just in the area that they came to me with, for example, their pain, but also other areas of their life, their cardio-metabolic health, their sleep, their risk of cancer, all that kind of stuff has improved because we've been working together. And so this is one of the things that I really try to focus on in clinical practice, which is how do we integrate the whole human? How do we take a 360-degree approach to healing in this patient? So that way, maybe we only need to do one stem cell procedure and a PRP procedure to get you 90% out of pain, as opposed to needing to do 2 or 3 stem cell procedures because your overall health is not fantastic, and you also have a severe chronic degenerative condition such as grade 3 or grade 4 osteoarthritis of the knee in multiple compartments. And so if you are, the take home I guess for you is, if you're not working with me, is if you are seeking out regenerative injection care and the provider that you're working with doesn't focus on this, meaning you just go in, get your injection and leave and then follow up on the injections, make sure you spend the time to do things on your own that are going to be beneficial for your healing long term. That's making sure you're drinking enough water, cutting out all that crap processed food that I've talked about over and over and over again. No high fructose corn syrup, no minimal to no processed foods. If you're gonna do processed foods, 5 or less ingredients. Do some intermittent fasting, some time restricted feeding, making sure you are sleeping well enough and deep enough. Use blue light blockers if you need to in order to help increase melatonin production. Make sure that you are exercising and getting blood flowing multiple times a week, so that way your body is better able to handle the healing that is going to be thrown at it when you get an injection. All right, I hope you appreciate this video, kind of giving you more insight, I guess, into how my clinical mind works and how I see patients. If this is something you liked, hearing more about my thought process on how I approach clinical problems, please let me know below and I'll give you more of it. Thanks.